Yes, Carl Rogers, humanistic approach. And already previous classes, uh, we already discussed about the psychoanalytical approach of Sigmund Freud and the behavioristic approach. Now, humanistic approach we were discussing in yesterday's classes. Okay, humanistic approach mainly there are three important aspects in the humanistic approach. Number one is empathy. Number two is unconditional positive regard. Number three is genuinity. Genuinity related to the person, genuinity related to the problem also. These are the three important aspects. And the main focus of this humanistic approach, humanism, that is developed by Carl Rogers, is that self means self-realization, self-acceptance, self-awareness, and self-esteem. These are the some core concepts of humanistic approach or humanism developed by Carl Rogers. Okay. Here in the humanism, always we need to give topmost priority to the client. Uh, and in some cases, we need to give the preference to the this problem as well as the person also, because this is a person-centered therapy. Person-centered therapy. Okay, so unconditional positive regard means we don't have any restrictions from our side, not have any restrictions from our side. Whatever the client may be, whatever the client condition may be, he may be culprit, he may be the murder, he may be the any other personality type. But we need to accept him as he is because he came to us because of some help. They seek some help, they need some help from the psychological professional, you can say counselors. That is the reason always be positive. So here in this person-centered therapy, always there are some these techniques we have to maintain when we are giving the therapy or counseling tips in this humanistic approach. Number one is there are four stages we have to maintain in this particular case. One is developmental stage. First stage of person-centered therapy, developmental stage, means we need to develop the rapport with the client. Developmental stage related to the developmental stage related to the development relations with the client. Okay. Second is non-directive stage of giving counseling. We know there are different types of counseling and how you give the counseling based on that. One is directive counseling. Second is non-directive counseling.
Non-directive.
Third is eclectic counseling, or you can say mixed counseling. Generally, these both directive counseling and non-directive counseling we apply in our counseling procedures. Directive counseling means always we will give the directions to the client, directions from the instructions from the psychological counselor, psychological professional side. But whereas in the non-directive counseling, we don't give any directions, direct directions. We don't directly can't give any directions. So depending on the clients, depending on the persons, depending on the individual's need. So that always we need to educate the person, empower the client, so that he will be in a position to understand him in a better manner. So that is the reason in this person-centered therapy, non-directive counseling, no direction, no need of giving direct whenever it is possible, wherever it is possible, you need to involve as a professionals, but don't give directions. Okay, non-directive stage of counseling. This is one stage, non-directive way of counseling. Then client-centered stage, focus on the person rather than the technique. We won't what is focusing on the person's or person qualities. So the technique, what are the techniques you are using in this therapy? That is a major focus in this person-centered therapy. Number one is developing stage. Number two is non-direct directions, stage of 9 directions, a phase of 9 directions. Because already you find out some qualities in that particular case. And here, non-directive counseling means no need of giving any directions because already he has some sort of knowledge, some sort of idea. So we need to create some sort of self-awareness in the client or self-realization. Means already the abilities are there. Only we have to show, these are your abilities. Try to identify this. Try to realize this. Self-realization is creating some sort of awareness in that particular case. So person-centered stage means now client-centered stage and person-centered stage means this goes beyond individual psychotherapy to include marriage, especially some sort of counseling related to the marital counseling, premarital, postmarital method, family counseling, group counseling. We use this sort of person-centered therapy. Okay, so just I'm just briefing this in a manner. After that, after 10-15 minutes, I'll explain. Then I'll show the slides. Okay. Then the other theoretical techniques are existential therapy, existential technique, existential therapy. Okay. Existential means what is existential? What is existence? Existence means
being or living.
Yeah, being in a present manner. Existential means uh, awareness of themselves. Number one, whatever we are now. Okay, that present situation we have to be there. Okay, existential approach always rejects the idea that what is going to happen in the future, what is already done in the past. So existential always human beings have no imagination. Okay, existential therapy deals with important of life themes. Life themes means such as living, dying, what is our freedom, responsibility to self. So this is also some sort of self-realization only, but existentialism always focus on the present situation, present condition. Existential psychotherapy examines the individual's awareness of themselves. As I mentioned, realization of self and awareness of self, self-awareness, self-realization. Okay. Individuals do not exist in isolation from others because we can't live in isolation. We have to be in the present context, present society, present situations, and what are the present context, what is happening in the present context. So existential approach always creates some sort of awareness, some sort of realization in the individuals, or you can say in this case. So some principles of existentialism is that one is I am experience. I am experience what I am. And if you want to explain in detail, so what is my personification? Okay, or you can say self-actualization, self-realization, self-awareness. That is the reason in existentialism therapy or in person-centered therapy. Yeah. So both are related to the humanistic approach. Okay, in both therapeutical procedures, we improve the insight of the client, insight, knowing themselves in a better manner. That is insightful, or you can say insightful learning, seeing into her own self is seeing introspection, or you can say insight. Okay, because we have so many abilities, competencies, but the problem is that we won't aware of those possibilities. We don't realize that we have some capabilities. competencies. So as a psychological professionals, that is our responsibility, that is our duty in the counseling procedure, especially in the client-centered and existential therapies. So create awareness, ask them to know them better. Okay, so here also there are different type of techniques. That is some sort of nature of anxiety. Anxiety also normal anxiety and neurotic anxiety. Normal anxiety is directly proportional to the situation, the present situation. So depending on the present situation, maybe some anxious. Neurotic anxiety is that neurotic anxiety is the disproportionate to the situation. It is usually repressed, denied. For example, if you accept the present situation, when you are in a position, when you are in the process to accept the present situation, maybe some sort of anxiety. That is normal anxiety. Neurotic anxiety means you won't even accept the present situation. You won't even accept the present scenario. But problem is that you will be in the past and future, not in the present. What is going to be happening in the future course of time. So that type of anxiety is neurotic anxiety. Normal anxiety is based on the present situation. So for example, if you want to if you want to admit in a new college, new course, new place, so some sort of this anxiety will have any individuals. That is normal anxiety. It is quite normal.
Sir, material not visible, sir.
As I told you, I am explaining the class now. After some 10-15 minutes, I will show the PPTs.
Okay, sir.
Just now network. Okay.
Okay, sir.
Yeah. So here, one more example I'll give you. For example, in the adolescent stages, adolescent development stage, in adolescent stage of 12 years or 13 years or 14 years, we know that 12 to 18 years is the adolescent stage. Normal anxiety is that there are some developmental changes when the person or the individuals enter into the adolescent stage. Okay, based on their situations, that is sudden changes in their physiological and psychological changes, some sort of anxious they will face. They'll have some sort of anxiety because of the sudden changes of the bodily or psychologically. So that anxiety is a normal anxiety. In some cases, what happens, they will tell you what's happening to my life, what is in my future course of time. So they'll think that this type of sudden changes may be some years together. But reality is that that changes in their body, in their mind, in their emotions may be only for temporary, only some months or some weeks. After that, they will habituated to that particular changes in their body. So here, these two type of anxiety, nature of anxiety is a different type. One is normal anxiety, means facing in the present situation, existence, the present situation. If you want to face, when you are facing the present situation, this normal anxiety will face. But if you think, what happened to my future course of time? What happens in my next level of life, next span of life, next stage of life? This is the neurotic anxiety. Means you won't even imagine. You need not imagine about your business. When you imagine, when you have some sort of situations in future course of time, if you want to imagine that, you will have some sort of anxiety. That anxiety is a neurotic anxiety. That's number one. Number two is what are the things that things are happening in your thought process. Better to discuss those issues with your family members or with any other nearby family members. So it is easy to share those things. Whatever the emotions, if you share, definitely your anxiety will be reduced. That is normal anxiety case. But if you won't share any emotions, if you won't share any feelings, what happens? That will be there in your mind. Okay, that emotional disturbances, emotional unstable. Because of this, both some sort of anxiety. That anxiety is the neurotic anxiety. Even guilt also. Guilt also. The guilt is same way, normal guilt and the neurotic guilt. Normal guilt means if you face some new person, new situation, new experience. So that is guilt by seeing or by experiencing, or if you have some mistake in your life without your concern, some guilt may be there. That is normal guilt. The same guilt, the same feelings, the same emotions, if you won't share with others, that will be in your last layer of your mind, as I mentioned, topology of mind, in unconscious or pre-conscious state, because you didn't share those feelings, this emotion to others. That is the reason you repressed those, not requiring, you are not that is sharing those feelings, those emotions to others. That is the reason that will be there in the repressed conditions. Or some people, though they have guilt, they won't deny it. So you, as I mentioned, you have to accept as you are. In initial class today, also the 10 minutes before, I told you self acceptance. If the problem is there, if the issue is there, you have to accept it. Yes, that is my issue. When you accept this issue, you will be in a position to resolve it with some help by others. So here, resolving the issue is one aspect, but if you are not accepting it, so that is the reason neuro anxiety, or you can say guilt. So here in existential therapy, better to accept as you are, better to be in the present situation. What are the problems we have? We need to accept it. When you accept your problem, definitely you will try to resolve it with some other skill. Here, as a therapist, what to do? So their anxiety will be the normal anxiety or any repressed issues are there in their unconscious stage or subconscious level. So identification of those repressed feelings, emotions, also the responsibility of the counselors here. In the counseling process, maybe in any stage, like developmental stage, second stage, or third stage, that is our duty as a psychological professionals to ask them understand in a better manner, creating some sort of self-awareness, creating some sort of self-identification, self-acceptance, self-awareness. Got it? So some life situations, these are fact. Life is living is the one important you have to be live in the present situation, present scenario, present society, present conditions. Second is in this four ultimate concerns of this particular existential therapy. Life and death also is real, is fact. Existentialism is that in existentialism, so death also one important aspect. We have to accept any point of time, maybe some of 60 years, 70 years, 80 years, it may be any situation that is unavoidable. Then freedom of life. That always, if you want to aware yourself, you want to that is having some sort of self-acceptance, self-awareness, and self-realization, freedom is the most important aspect. In a stressful conditions, in a forced situations, it's not so easy to identify your own positives and negatives. That is the reason always try to be with free mind, or you can say mindfulness. Okay. Isolation is also another important aspect. If you want to, there are two important aspects of isolation. We have to be in the present situation, present generation, present society. Isolation is HR would like to discover self. So when you are in a position to identify yourself, you have to be. One aspect is that isolation is in one aspect. Isolation means you discover yourself in a better manner. Okay, don't compare with other individuals. Your positives, your competencies, your abilities, and your negatives also we have to check and we have to identify. And always try to think what is the meaning of life. You have to seek the life's meaning. Okay, the present situation, present scenario, existentialism is that. So in this, what is existential therapy, one technique is that cognitive restructuring technique or cognitive reframing technique. It is the most important technique in the existential therapy. Cognitive reframing means, what is cognition? Cognition means thought process, your understanding capabilities, your knowledge, interpretation, or perception. If this cognition is not in a positive way, in an appropriate way, age appropriate way, so better to reframe, restructuring their cognition, thought process. In person-centered therapy of is humanistic, and the existential therapy also focuses on self, self. If that particular individual's cognition is not age appropriate, so better to restructuring. Why the board restructuring means, for example, if the person is having, if person's age is 20 years, is it possible to change his overall cognition? Only restructuring. If there's any repairs in the building, so what we will do? Restructuring that building, reframing that. That is the word here. It is reframing of their cognition, the thought process. Maybe he's educated, maybe he has some experience, but still some sort of thought process, some components in their cognition, some components in their thought process to be changed. That is the reason, reframing of cognition, restructuring of cognition. Here in this case of restructuring and reframing also, don't give direct direction, only through non-directive method. Ask them just one example. Just you can ask them, is it the correct way of thinking in that particular aspect? That means he will think or she will think, hey, so I need to check my way of thinking. When you ask some questions, when you counsel that particular case, when you paraphrasing the particular case, then they will realize it. Means you are creating some sort of awareness. They will think, yes, maybe some wrong in my thought process. I have to change my way of thinking. So that they will have some sort of self-awareness. If the self-awareness created, automatically they will accept their mistake. They will accept their issues. Once they accept it, definitely they will try to modify their behavior. They will try to change their thought process. That is reframing, restructuring. CRT. The technique name is CRT. Cognitive restructuring technique.
Correct.
CRT. Yes. Okay. Ask. Tell me. Any doubt? Hello, you're asking something, somebody. Then in the next one, some counseling techniques for substance abuse. What is substance abuse? Substance abuse.
Some substance like alcohol
Yes, yes.
or neuro.
Some list of substances. One is alcohol, then cocaine, then nicotine, sedatives. These are all some sort of substances. Okay. So in the substance use, depending on the psychoactive substances used, how they are using, based on that, these type of patients, these type of individuals are divided in the different categories. One is beneficial use. Okay, spectrum of psychoactive substance use, how they are using. For some cases, they need some sort of this substance depending on the medical advice, depending on the doctor's advice. That is known as the beneficial use. So that has positive health, for spiritual or social impact. So medical or pharmaceuticals, that is some sort of advice they'll give. So that is known as the beneficial use. Second is non-problematic use. Usage of substance are different type. One is beneficial use. Second is the non-problematic use, means some recreational activities. So casually for social gatherings, they will use some sort of limited substances. Okay, that is known as the non-problematic use. One is usage of medical benefits, or you can say beneficial use. Second is the non-problematic use, or you can say casual use. Third one is the problematic use. Problematic use means use that begins to have some negative consequences for individuals. Okay, so problematic use. Fourth one is the chronic dependence. Chronic dependence means so they depend only on the particular substance, that is known as the dependency, chronic dependency. Okay, so that is one classification of usage. Second is the substance abuse. Substance abuse also there are some classifications. One is dependent. Second is heavy use. Third is heavy use in the moderate problem, serious problem. Heavy use also there are different type of problem. Moderate problem by using heavily, moderate problems, and then serious problems. Then non-problematic and problematic usages. So here this type of different classification of usages. So based on the quantity of usages, then based on the these problematic issues. Okay, then how this is depending on the individual's concern. There are different type of problems. So resolving or avoiding legal problems. What happens if these issues are continuously happening? There are some sort of legal issues they need to face. Classification of problem is that one is legal issues. Okay, legal issues means what are the legal issues? What type of legal issues can face?
Smuggling.
Yes. Then drunk and drive.
Human trafficking.
Yes. So these are and even family issues also.
Yeah, accidents and whatnot.
Yes. So here,
Yes, sir.
as I mentioned, it is one is legal problem. Second one is the family issues. Third one is the financial aspects. Financially, there are some burdens. Financial burdens they need to face.
Yes, sir.
Then job stability, maybe some sort of occupational stress, occupational issues. So that also they need to face. Then
Unemployment.
yeah, unemployment and some sort of physical, mental, and emotional issues also maybe. So in this substance case, as I mentioned, substance are some sort of nicotine, alcohol, cocaine. These are the different type of substances. In usage level, problematic usages, chronic dependence. The non-problematic usages, medical advice, beneficial use, you can say. Then what are the major issues in this means? Legal issues, family issues, financial issues, and then professional issues. Then here, in this case of even social issues also they'll face. Then
Career goals.
yeah, how to at least resolve it means through some sort of counseling techniques. In the counseling techniques are medical help also different. One is OPD cases, like outpatient type of cases. Second is inpatient cases. If it is a problematic case, better to admit them in a inpatient as an inpatient person, inpatient in the psychiatric hospitals. Then some sort of rehabilitation is also available. If the problem is a chronic issues, better to admit them in the that is rehabilitation centers. Okay. So here again, same techniques. What are the techniques means? As I mentioned yesterday, ABC model, then CRT, cognitive restructuring techniques also be used in this case of drug addictions, alcohol dependency, and any substance usages. Okay, just I will show some these slides related to this particular topic. Network is slow here. I'm trying to put it back. Please wait for some time.
Okay, sir.
Hello.
Yes, please.
Hello.
Yes, please. చెప్పండి సార్.
Yes, sir.
Am I audible?
Yes.
Hello.
Yes, sir. You are audible. Perfect.
Hello.
Yes, please. I think we are not audible to you.
Audible,
Hello.
sir.
I think we will put it in the chat.
Hello.
Sir.
Why the network is slow? Is it okay for? Am I clear now? Am I audible?
No, sir, no.
Audible, sir.
Present, no, sir.
Audible, sir.
Some
Not
disturbance from the
visible.
network, no?
Not visible.
Hello.
Hello, sir.
Hello.
Sir.
Hello.
Sir, tell me, sir.
Am I audible?
Audible, sir, but not visible.
I think network is slow.
Could be, yes.
Hello.
We are able to hear
Sir,
you.
Now I am here. No.
Yeah,
So here
yeah.
in system it is some problem. That is the reason
I
another mode I
think,
am using. Okay.
yeah.
Yeah. So here one important is in this dependence cases. One is how to counsel these persons. Means one is resolving or avoidance the legal problems. That is one type of techniques we have to use in the counseling procedures. One procedure is that resolving and avoiding the legal problems. If they face any legal problems, that issues they have to be resolved. That is one thing. Second is that attaining financial stability, how to improve their financial stability. That is also another area we need to give counseling. Then attaining stability in family relationships. Maybe if there is any family, so as I mentioned, some sort of issues related to the family, related to the it is legal, related to their it is financial, job. So in these issues, how to resolve how to use our counseling techniques. One is that resolving the legal problem. If there's any legal problems, better to resolve those legal problems. That is one aspect. Second is that attaining the financial stability. One example already given yesterday. So resolving the legal aspect. Second is the attaining the financial stability. Okay, if there's any financial disturbances, ask them to stop using that the substance. Okay, it is as I mentioned ABC model. ABC model is one of the important technique we can use in the counseling of substance abuse. Then setting and meeting career goals. For example, due to their issues, they may not be in a position to reach the goals. So whatever the goals they set, but due to their problems, due to their legal, due to their family, due to their financial instability, they may not be in a position to reach the goals. Now ask them to set new goals and ask them to reach that goals. Okay, that is another thing. Then improving assertive techniques, assertive skills, assertion skills. So how to discuss with others, how to share their issues with other family members or any other colleagues. That also we have to improve. Then improving the social skills. What happens in this issue of substance abuse? The social skills also will be deteriorated. They won't mingle with other members in the society because of their issues. So that is the reason ask them to improve their social skills. Previously, they won't even mingle with other members of the society. So you just in our counseling procedures, better to ask them to improve the social skills. Now we are discussing what are the counseling methods, techniques we need to use in case of substance abuses. Okay. Number one, as I mentioned, we have to give the counseling to resolve the legal problems. Okay. Number two, attaining financial stability. So because of due to their this substance abuse, addiction cases, so they may not be in a position to to manage their financial aspects. Okay, to plan their financial aspects. So now, so after stopping the usage of these substances, better to ask them to attaining financial stability. That is the another thing we have to use. And improving social skills, setting career goals. Okay, improving is social skills, improving assertive manner of skills. Then enhancing physical health and fitness, enhancing physical health and fitness. Physical health and fitness means due to their addiction, due to their heavy intake of substances, their physical health may not be fit. Now, enhancing physical health and fitness also other area of our counseling. Then learning more effective methods for coping strategies. Maybe because of their
alcohol addiction or any other substance usages, the coping stages may be very less. Now, ask them to learn more effective methods of coping and stress relief techniques, developing more effective problem solving and decision making skills because of their health, because of their issues, their problem solving techniques may not be age appropriate. So here problem solving skills need to be improved in our counseling. Then decision making skills. You know that in these particular cases, they won't be in a position to decide. Decision making will be very weak. So that decision making skills also we need to improve in these cases. Okay. Then relaxation techniques, some sort of relaxation techniques we have to develop. Relaxation techniques also better to ask them to learn some sort of relaxation techniques to relieve their stressful conditions. So learning to recognize and express feelings, whatever they, as I mentioned, in this both this existential therapy and the person-centered therapy, recognizing their or identifying their positives. That also we have to improve in this type of cases. Then adapting more effectively to work. So adaptability to be improved. Okay. So adaptability, especially in these cases of addicted cases, they won't adapt to the new situations, new environment. Okay. So he adaptive methods also to be improved. Developing social support system. Yes, social support system means social support system from other members in the society or through some sort of associations, okay, or some sort of clubs. So this type of that is techniques also we have to improve. Increasing involvement in recreational and social issues, social activities to be improved and recreational activities to be improved because of their isolation, because of their issues, they will be isolated from the society, from the groups, from the family members, from the relatives, from the colleagues also. So here we need to improve the social skills, social support system also we have to improve, some sort of recreational activities and social activities also to be improved. Then dealing with the mental health issues because of their physiological, emotional issues. So their mental health issues also will be more. So here also we have to improve the mental health. We have to address the mental health issue. Then improve the self-esteem and self-efficacy. Self-esteem to be improved and self-efficacy also we have to improve. Okay. So these are the various techniques of these particular cases. Yeah. Hello.
Sir.
Are you following that?
Yes,
We are
Okay.
yes, sir.
Even the rehabilitation centers also, rehabilitation programs also, some sort of long term rehabilitation service are needed. Long term rehabilitation, some sort of 3 months, 4 months, 6 months. This type of rehabilitation service we have to improve in these cases because for 3 days, 4 days, as I mentioned, different type of that is methods. One is outpatient agencies, outpatient counseling agencies, then employment assistance programs, recreational activities. So these type of services we have to provide in these cases. And not only these cases, some sort of clubs like alcohol dependence, these people will form a group. Okay. So nowadays there are so many different groups are available to ask them to be in that group. Okay. then for drug cases, for drug addicted case also, different type of methods. One is medicines for quick relief. Okay, some sort of medicines to be suggested, prescribed from the this medical professional side. Okay, and some sort of recreational activities also have to be improved. Then involve these persons in various activities of societal activities or recreational activities or any activities of the clubs and these associations. Okay, why? Because due to their these psychological and emotional conditions, generally these people of addicted issues, they won't mingle with the family members. So here our counseling part is that, so we have to find out the reason why they are habituated to this particular substance. That is one thing we need to identify. Second is that whatever the reasons may be, so their level of understanding, if you want to go for counseling, whether they are in a position to understand it or not. In some case, what happens, their cognitive aspects, they won't be in a position to understand. Okay, in such cases, so ask them to admit in any hospital or any centers of rehabilitations. Yes. So, as I mentioned, in person-centered therapy, his condition has to be assessed. His condition has to be observed. So when you observe the condition of the client, when you observe the condition of the person, definitely you'll have some idea whether this case is this issue may be resolved to the counseling or not. Second is any medical help is needed. That also we had to check. Medical help means it is doctor's help. Whether you know it or not, I don't know. In psychiatric hospitals, some type of 2 to 3 weeks inpatient facilities also they'll provide. Okay, so first of all, as an OPD case, outpatient case. Second is an inpatient case. Third is, if it is possible, for rehabilitation care also. For months together, they have to be in the rehabilitation centers. In the counseling process also, direct counseling you can give to the clients or the caregivers. Because if he or she is not in position to understand that issue, better to go for the caregivers counseling. Caregivers counseling means we have to give the counseling to the caregivers, because directly want to give the counsel that is client, maybe he is not in a position to understand you. Whatever you are giving tips, whatever the counseling techniques, maybe his condition is not in a position to listen you. In that cases, better to give the counseling to the caregivers. So, or you can say psychoeducation also you have to provide to the caregivers. Yeah. Any doubts, anything?
No, sir. Thank you.
Still, I am trying to share the PPTs, but it's not okay. The slides are audible now, or that is visible now?
No, sir.
Visible. Jai Shri Ram.
Now?
Not
No,
yet.
sir.
Now?
No, sir. No.
Sir, I think you don't have the co-host access. That is the reason it is not visible.
I think, yes.
Mm-hmm.
So please ask the BRAU team to give access for co-hosting so that we can see the slides.
బలరాం నేను 4:30 తర్వాత చేస్తాను, నాకు క్లాసెస్ అవుతున్నాయి. నాకు క్లాస్ అవుతుంది, 4:30 తర్వాత చేస్తాను. హలో.
Madam, unmute yourself.
ఓకే ఓకే.
హోస్ట్ ఒక కోడ్ ఇస్తుంది కదా సార్, దాన్ని బట్టి లాగిన్ చేయొచ్చు.
Now, previously already we have shown some right previous class. Is it visible now?
No, sir, no.
No. No.
Now it is.
Sir,
Is it-
visible, sir. Visible.
Is it visible now?
Yes, sir.
Visible, sir. Visible.
Yes.
Congratulations.
Yes. So this is one type of adaptation to loss. Is it visible now?
Yes, yes, sir.
Visible, sir. Visible.
Yes, yes. See, any case, that may be the addiction case, maybe any other issues. Okay. Hello.
Yeah.
Sir, sir.
So here we need to identify whether the particular case is this is model of adaptation to loss. Are you seeing this graphical representation? One graph. Yeah. Hello.
Yeah.
Model of,
You
sir.
can increase the slide size, sir, by clicking on the cup.
Okay.
Because this is too small, not visible.
Shock, confusion.
Model of adaptation.
Is it that model of adaptation? Are you able to see this?
Okay, sir, you continue. We will little exert and try to understand here.
Model of adaptation is there. Which side first? Hello.
Yes.
Model of adaptation. Just you tell me.
Shock, something is the denial, anger.
Yes, this one. Yes, exactly. Yes. This is the slide of model of adaptation. I want to explain this one only today. Okay.
హోస్ట్ ఆడియో మ్యూట్ చేస్తే అది సౌండ్ రాదు సార్. అది నిన్న సేమ్ బాలకృష్ణారెడ్డి సార్ క్లాస్ లో కూడా అయింది.
ఏమైంది?
అది హోస్ట్ది కూడా రీసౌండ్ వస్తుంది సార్.
1 minute.
Sir, share in PPT. Share.
Is it visible now?
Visible, sir.
Here, model of adaptation to loss means there are 7 stages of adaptation. One is shock. Okay.
Okay.
For example, in any case of addiction, after testing from the medical professionals, if his condition is not up to the mark, his health condition is not good, what is the first response of the person?
He'll be in a shock.
Shock. So here, shock means confused state. Then what is there in the that is this thing? Numbness. In slide, shock as well as
Denial is there.
confusion. Then
Shock, confusion, and numbness.
second is denial. Why denial? Because he don't know. By seeing that person, you can easily say he is a healthy person. But based on the reports of the doctors, his health is not good. So he won't accept it. That is the stage of denial. Okay. Please try to respond whether you are.
Yeah. Okay, sir.
Yes, sir, we can.
Second one is right. Then third is anger.
Third is anger. Now, as a psychological counselor, we need to identify the patient in which state they are.
I see.
So where to start your counseling procedures? Got it?
Yes.
Shock.
Yes.
A person is having some sort of issues, maybe